Well, welcome to the other side of medicine, everyone. I am Dr. James Christosic, aka Dr. Good Carbs, and tonight we are excited about having a special guest on the other side of medicine. It's Demetria Clark. She's a master herbalist and she's an author, and we're going to be talking about children's herbalism, herbs for children. And this is going to be kind of cool because she really has an extensive background in herbal medicine. It's pretty impressive. And at a very young age, 13 years old, she was already delving in, learning about herbs, and she was very curious. This is a pretty amazing woman. And so then she continued to pursue her interest and went on to study with some of the premier herbalists from around the country, a lot of other women who are herbalists and men who are very well known. And she continued to pursue this career and her destination to become this master herbalist. And so she studied with people like Rosemary Gladstar, who's, I guess, one of the premier herbalists, one of the pioneers, along with one of my mentors, who I studied herbalism way back in the day with Dr. Christopher. Dr. Christopher was an amazing man and understanding. When I was talking to Demetria here before the podcast, she was telling me that this lady, Rosemary Gladstar, was one of the proteges or colleagues of Dr. Christopher. So I wasn't aware of that. That's pretty cool. And then she studied with people like David Hoffman and Christopher Hobbs. And then she went on actually studying in Europe, in Switzerland and in Germany and Ireland and in the Caribbean, and she was able to go around the world and learn from the herbalists who were local and some study with people around the world. Pretty impressive portfolio this gal's got. And then she became an herbalist and she studied and more, and she started writing books. And tonight we're going to talk about one of her books, Children's Herbal Healing. And also she has a school of herbal healing and herbal medicines where you can actually become a student in her school and learn from this years of wisdom that she has. And so we'll talk about that school and just a lot of exciting things. So I think you're going to be in store for a really exciting podcast tonight. So if you have family or friends who don't know about the Other Side of Medicine podcast, oh my gosh, you got to tell them, because we have some pretty amazing people like Demetria here on the program, on the podcast. As you know, I've been on the radio for many, many years, and now I've moved over the last year and a half on podcasts, and I'm pretty excited. So, Demetria, welcome to the Other Side of Medicine.
Thank you. Thank you for having me.
It's good to have you with us. So, tell me and tell us, how did your interest at the age of 13? How did you start getting interested in herbal medicines?
So I actually lived next door to someone who owned one of the largest herbal wholesalers in the country. And so they would ship herbs all over the world, and they would travel to source them. And
what company was that? What company was that?
It was called Attar.
Okay.
It's no longer around. It was in New England.
Okay,
and
gotcha.
They supplied a lot of the herbal companies that are still around today. It's been bought by someone else. This was years ago. And the owner would answer all my questions, and she was really kind to me about that. And then I lived in a commune for part of my teenage years and went to an alternative Quaker school. So there was a farm program, and the commune had midwives and herbalists. So people.
Was this a Quaker commune?
No, it's just a hippie commune.
Okay, gotcha.
No religion or anything like that. It was just, gotcha. It was in New Hampshire, and people live there for different reasons. And so I lived there for different reasons too. But really my first introduction to herbalism was when I was really young, and we lived in Alaska. And it was in a Coast Guard community. So there were people from all over the United States. So when our neighbors from Puerto Rico moved in, everything they did smelled so different because they were cooking with all these different kinds of herbs and spices. And so I'd ask my mom questions and she would ask them questions. And then we had neighbors who were indigenous or people who went to school with me who were indigenous. And so their families did different things. And I always just asked a lot of questions when it came to stuff that had to do with plants. I'm not sure why, but like, I always just really like could connect with things through smell. So different plants would smell different ways, and it would just excite my interest. And then I like to draw, so I would draw plants. And then we didn't have television when I was a child, so we spent a lot of time outside. We were those kids whose parents were like, "Come back when the street lights were on," but where we lived, there weren't street lights.
It's interesting you grew up in that kind of environment with no television, but you found a way to be creative. You found a way to do art and to draw things and to explore nature. And so you really should be thankful to your parents for not having the television, because today kids are glued to the TV and to the internet, and they're not getting that kind of stimulation that you were privileged to have. So, wow, that's pretty cool.
Yeah, no, it is. It's interesting because children really miss out on the fundamentals of getting dirty.
Yeah,
around.
yeah.
I remember my kids were homeschooled, and I remember going to a homeschool group once, and I raised wild children. So my kids would be like jumping around and making swords out of sticks and doing all this crazy kind of, jumping on rocks and puddles. And they were like, "Are you going to let your kids do that? They're so hostile." And I'm like, dude, these are my kids. They're not hostile.
No,
they're just playing. They're having fun. They're jumping around. And when I get to take them home after this, they're going to go to bed because they're tired.
Yeah, they'll be all tired. My wife and I homeschooled our 6 children.
Oh, wow.
And we had very similar experiences, and we were able to have our kids explore. We lived on an 11-acre farm. Nice. And my kids grew up in that environment. We had 2 ponds and a stream running through our property and ravines, and they just had an unbelievable time playing in nature and exploring and learning, just like your children did. And kids don't get that today, and that's so sad, isn't it?
Well, it's definitely sad. But what I think is even sadder is that we've removed things like recess from children's school day, so they don't even get a real physical break from being in school. And I don't know.
I was not aware that they did that. Oh my God.
So there are some places where, kids don't get a full recess like they used to.
Wow.
And a lot of, I don't know how I look, you put me in a chair for 6 hours, I'm not behaving. I'm just not.
That's right.
I'm not going to behave. I don't have it in me.
Sure.
I was,
what's really cool. Let's get, getting back to the herbs. When your kids were growing up and playing out in nature, they were around the herbs. They were seeing them. You were pointing them out to them. And then when maybe they had a little bit of an illness, I'm sure you went out and picked some herbs and showed them which ones you're going to be using to help them. That's the cool thing we do with our kids. And I'm sure you did the same. It was a beautiful experience to learn how the synergy with nature and food and herbs and everything works together to heal our bodies. So that is really awesome. So, we had very similar experiences with our family. So let's talk about childhood illnesses, the common childhood illnesses, and the very first one everybody thinks of is, of course, an ear infection, right?
Mm-hmm.
Yeah. So statistically, we know that, almost every child is going to have at least one ear infection in their childhood, but not that. See, we think that's normal, and it's really not even normal when you consider why it happens. And so let's talk a little bit about what are some of the alternatives to the antibiotics that everybody runs to, which, by the way, as you and I know, that most of the ear infections are not caused by bacteria. They're usually caused by viruses, right? So it's kind of crazy. So what kind of remedies do you recommend when a parent's dealing with a childhood ear infection?
So if they're breastfeeding, I tell them to put breast milk in the baby's ear.
Nice.
It
Nice.
works. It works. Everybody's like, what? And then they're like, whoa. And they're like converted and they're like using breast milk to like
I
polish
love
their
that.
car,
Good,
right?
good job.
They're
There's
like,
an
we can use
herbalist,
it for anything.
an herbalist that says, go to the mother's milk first. I love it. I love it. Good job.
Yeah. So then, you know, you have your mullein flower oil, St. John's wort oil, garlic oil. Those things can work really well. Also, I remember my oldest had an ear infection and my husband was in the service at the time. And so I took him into the Army hospital and I needed a diagnosis, but I just wanted to make sure that I knew I was right. And the nurse practitioner is like, well, I'm going to give you this antibiotic. And I was like, I'm not really interested in the antibiotic. I'll take the prescription, but I'm not going to fill it unless there's a problem.
Yeah, so
I'm actually
like,
just going to use
happened
mullein
is-
flower oil. And she's
Yeah,
like,
right.
oh, yeah, use that first. And
Yeah,
I was
yeah,
like,
look.
great, because I was 21 and I was
Yeah.
trusting my instinct. And she was like, oh, no, use that first if you have it. And I was like,
Yeah,
okay.
Yeah.
So,
Well, you know, the thing is really interesting. You just wanted to get the diagnosis. So for you, it was diagnose and adios.
basically, yeah. I just wanted to know. I wanted to know if I was right. Because obviously, if there was something more serious going on, I
Sure.
would want to know. But and then that child probably wasn't sick again until he was like 4. My kids
Sure.
didn't ever really get sick. So when, you know, he's pulling on his ear showing classic ear infection signs, I'm like, is this right? I mean, this kid never gets sick. This kid never, you know, he's a pretty
Well,
happy
that's
baby.
really
So
That's really
Yeah.
interesting because you said your children hardly ever got sick. My 6 kids.
I didn't get to test any of my remedies.
What's that?
I was kidding. I was saying I didn't really get to test any of my remedies.
Oh, that's fun. Well, that's okay. You had them. You had them
Absolutely.
available. They were in the
We
back.
had lots of
burner.
preventative.
They were in the back burner if you needed them. But I'm sure you helped a lot of other families with how to use the herbs to help their children. But you know, it's really interesting. My children hardly ever got sick as well. And of course, when they did, we would rely on the herbs. I think maybe out of the 6 children, we maybe had 1 or maybe possibly 2. I think it was just maybe 1 who had a slight ear infection, and you know, we just dropped some mullins and garlics herbs in there, and boom, was gone. You know, but what most families don't know, as I'm sure you are well aware, that the reason that the children get ear infections, especially if they're repeated, is because of food allergies.
Yeah, it can definitely be that for sure.
Yeah, and that's it's when you
Or
have
smoking in the house, which isn't
Oh,
really
yeah.
something that it's not something that we really see a lot of anymore. But 20 years ago, people still smoked in their homes. I think I mean I don't know if anybody does anymore. Most people, if they smoke outside.
That's good. That's good.
But you know, the reality is smoking was a big thing for allergies in children.
Oh yeah. Well, yeah, but when I'm talking about primarily, even if there's somebody that's not smoking in the home, that food allergies are the major cause of, you know, repeated ear infections. That is, if a child has, you know, 2 or 3 ear infections every year, you got to start thinking food allergies or a nutritional deficiency. I mean, I'm sure you're well aware of that as well. So, but the herbs, let's talk about the herbs again, so that parents could have them in their home just in case they need them as they're raising a family. Let's talk about those herbs again, and you know what some of those remedies are. You mentioned, you know, mullins and garlic and St. John's wort, and you know, what are some of the ones? Do you have a favorite company that you, or do you make any herbal remedies? Do you sell them? I mean, let's talk a little bit about that. I didn't even ask you if you did that.
No, so I don't. I used to make products years ago, and I had a large products company starting in 1996. And in about 2000, I decided I didn't want to do that anymore. I just wanted to teach. My kids were getting older. I just needed to change the way I did things. So that was a big thing for me. But
did you sell your company?
So I actually passed it on to 2 students.
Oh wow!
I opted to not sell it, and
good for you.
They run it in different entities, like still, I think, to this day. But I just decided that I just didn't want to. If I had sold it, I would have had to sell my name, which is my first name. So I didn't want to do that. So I
Sure,
opted
sure.
to just pass it on. And so I gave them the recipes, the formulas, and they
Very
could
nice.
continue to do the work. And so that was something that that's
Yeah,
kind
that
of like
makes
how I do things anyways.
good for you.
But
But-
there's
So
lots of
what?
great companies out there.
Sure. Well, I talked earlier about one of my favorites is the Herb Farm,
Mm-hmm.
PHARM. That's one of
Yep.
my favorite companies. I'm sure there's others. What are some of your favorite ones?
So I don't mind products from Mountain Rose Herbs. I like Gaia and I like Herb Farm. And I really tend to
I
keep
like
it
Gaia
simple.
too. Gaia is one of my favorites. That's my second go-to.
But if I need something, I tend to make it myself. Um,
Yeah.
but and when my kids were little, that was the same thing. Like who needs 84 gallons of mullein oil? Oh, I do. But but if I need something now, if I don't have time to make it, those are companies that I trust. They've been around for a long time.
Sure.
I've never had a bad experience with them. I'm sure, someone could come up with something someplace, but the reality is that I trust them.
Yeah, well,
And
one of the cool things about Herb Farm, and again, that's not the only good company. That's one of the
fabulous
things that both
company.
you and I agree it's a very good company. But one of the interesting things about that company is that most clinicians, most doctors, whether they're chiropractors like myself or naturopathic or medical doctors, all of us who are practicing functional medicine, a majority of the doctors that really are in the know will use Herb Farm at least as one of the primary companies that they use. So it's really a reputable company, and it's
Yeah.
pretty easy accessible in a lot of stores. Whole Foods carries them, and you can order them online. But it's a good company. So, but Guy is another one, and you said the Mountain Herbs. I like that company too. I buy from them too as well. So we're in the same wavelength. That's pretty cool. So, well, let's talk a little bit. Okay, so we've got mullins and garlic and St. John's wort. Is there any other ones that mother's milk? I love the
Yeah.
first
Oh,
two.
yeah. Well, the first one's breast milk. I mean,
I love it. I love
eczema,
it.
breast milk, ear infection, breast milk. I
I
mean,
love it.
pink eye, breast milk.
That's it. Yeah.
That's
Yeah.
all,
Oh, yeah.
like those are always good ones. I mean, for herbs, like for internal herbs, because those are all infused oils that you would put a drop or two in each ear. I like echinacea and garlic and breast milk. Keep it simple.
Sure.
I think there's this almost big time thing like, oh, we need 75 different herbs and all in one formula. I tend to be like, no, let's just keep it simple. Yeah.
I love it.
It's like that KISS, keep it simple, stupid.
I
That's
love
what I
it.
have to tell myself when I'm like getting ahead of whoa, slow down, speed racer. Like,
Sure. For our listening audience that really maybe this is a new venue for them. They never heard about the herb echinacea. We live here in Ohio. Echinacea grows, in Ohio. It doesn't grow wild. I don't think it grows wild. I have to check and see that out. I know that I have echinacea plants in my flower garden. I never really saw echinacea wild growing in Ohio. I imagine maybe some parts,
maybe
maybe
Tennessee, the Tennessee variety may
I think maybe
grow
maybe like
wild.
Southern Ohio, maybe they have it. But for our listening audience who don't know about echinacea, let's talk about that herb because boy, oh boy, you and I know that is one of the strongest herbs that you can use internally, but also externally. I mean, if there's one remedy that I have that I take, and I'd love to share this with our audience, and I'm sure you've used it before. It's the super immune boost.
Oh,
Um,
yeah, yeah.
by, by, uh,
I
by
don't know if I've ever purchased it, but I've definitely made a variety of it because that's the
Sure,
one
sure.
with the
Well,
echinacea and the
I
bulbous
don't
seed,
have
right?
time as a clinician to go and make the herbs. I mean, I admire you for doing that and all that.
It's mostly because I'm lazy and a control freak.
Oh, that's good. Well, but you got the skill. You can teach your students as you make and mix all these formulas. That's really cool. But for me, that super immune booster, it used to be called echinacea compound. Is what it used to be.
Yeah, that's right. That's right. I remember
Back in the
that.
day, when I was using it for my kids, it was called echinacea compound. Today it's called super immune boost. My friends, if there's only one remedy that you get, I encourage you to get that. If I only had one thing to get, you either make it myself or get it from Herb Farm. That would be one thing that I would have for internal and external conditions. I've seen it work amazing wonders with people with infections, that were either, you know, uh, urinary tract infections, ear infections, whether it's skin infections, or I've even seen it work on sepsis. Not that I'm
Mhm.
recommending people that go out and there try that unless you have a trained clinician know how to handle that. I've seen it when patients that I've seen, they ask me, well, I don't want to use antibiotics, and they say, well, okay, well, here's what you do, but don't tell them that I said to use it, because I'm just going to give you what the research shows. And I told them to use it, and the septicemia, they had a streak going up their leg. And that's a dangerous thing when you have a blood
Oh
infection.
yeah, it can kill
And the
you.
echinacea, super echinacea booster, the super immune booster cured it. But the only thing about herbs is, oftentimes you have to give it in a regular dosage, maybe sometimes every hour, every half hour, every 45 minutes. Just keep on giving that boost of it. That's what I found. Now, maybe have different experience than I have, but I've always went on the side of safety and just saying, okay, I'm going to give it every hour, hour and a half, and small dosages, but it's just like a titrating it down, keep on giving it to the patient, or it works amazing. So what's your experience with that?
With echinacea or
With echinacea,
septicemia?
yeah. No, just with
Okay,
echinacea.
because I don't have any experience with septicemia. I mean, I would obviously tell them to follow their clinician's protocol, and then I would, suggest using an adjunct like herbs. But I mean, echinacea, it's antimicrobial, it's antiviral, and it's
Fungal?
antibiotic, immune stimulating. I mean, it's so if an herb, you mentioned Herb Farm, and so I said I hadn't used their compound and I hadn't used their blend, but I have used their echinacea before, and it makes your tongue tingle. That's when you know it's
Thank you for
good,
bringing that
right?
up. Thank you for bringing that up. That's a test for a good echinacea, by the way. If you take a tincture of an echinacea compound or echinacea by itself, that what you just brought up right there is a good marker for people to know if they're getting a quality echinacea. That tingling on the tongue,
Absolutely.
that's the key. That's the key right there.
And so a lot of people who don't know what echinacea is, it's also called purple coneflower when you're at the plant center, right? So you can start your journey with it by buying purple coneflower, echinacea purpura. There's a few other kinds of varieties. So it's a
Gustifolia,
pretty, yeah,
Gustifolia.
absolutely. Those are usually, you don't find those in a garden center, the Angustifolia. So if you just wanted to start with something inexpensive, easy to find, you could definitely do that. It's well worth, it's a good plant to start your herb relationship with, because one, it's so powerful. Two, it's easy to find. Three, it wants to grow for you. It does not have attitude when it comes to growing. It's like, okay, I'm going to put in roots, and you can harvest the leaves and the flowers the first year, and you can wait a few years before you harvest the root. And it's really easy to use. You can use it as a tea. You can use it as a tincture. You can use it topically as a compress made from the tea. You can use it as an oil. And it's really easy to use. And it's one of those herbs that can give you a real sense of, oh, this is working pretty quickly. So you also have like a high level of success, which helps you build your confidence herbally. Does that make sense?
Oh, yeah,
So
absolutely. That's a good point.
children usually do really good with it too, unless they're allergic to chrysanthemums, marigolds, or ragweeds, or other members of the daisy family. But
My
overall,
wife,
it's considered safe.
my wife is allergic to echinacea, and it's a real challenge when she's had some pretty dramatic experiences with infections. Before I met her, um, she had a lot of allergies. She had a lot of things with her gut going on, a lot of things, and so um, as we kind of went along. This is my second marriage, and we discovered that because of her, well, she ended up having an infection on her leg. She got a really bad cut on her leg, and it didn't. I put herbs on it and everything, and it was getting better. And then I said, "You got to keep on putting them on." Well, she didn't, and it got pretty bad. And she came up to me about 3 or 4 days later and said, look at this, it's pretty bad. And I said, yeah, it's bad. And so we started treating with herbs. And I said, okay, you gotta, when you go to work, you're gonna have to take this formula about every couple hours. And she works for a dentist. She does, she's licensed to put in fillings. And then she does all the drilling and everything. So she said, oh, I was all busy that day. I couldn't do it. So she came home. She came home and it was just flared up really bad. And I said, okay, I can't deal with this. You're going to go to the emergency. And we did. Well, they gave her antibiotic. I knew they were going to. And 3 days later, it was getting progressively worse.
Ooh.
So we went back to the emergency. I said, I'm done. If you can't take these things away, I'm telling you, I'm done. So we went back to the emergency. This time they gave her different oral antibiotic, and they gave her intravenous.
Ooh, wow.
3 days later, Demetri, it was progressively worse. So I said, okay, enough is enough. You're staying home. You're not going to go to work. Because I know if you go to work, you're not going to take this stuff. You're going to get too busy. So you're staying home.
Well, and she works with people's mouths, which are like the dirtiest things in the world.
Yeah, thank you. Exactly. So yeah, I didn't mention that, but you're absolutely right. But so it turns out she had MRSA. Yeah, she had MRSA. So anyways, after about a week of staying, I had to get up at night. I put compresses on at night. I used, you know what bentonite is. I used bentonite compresses, and I alternated them with compresses of charcoal compresses. And then I gave her herbs through the night. And after a week, her leg was really infested with this MRSA. It was bad. Wow. And it went away. It went away.
Oh, good.
So the antibiotics didn't touch it, but the herbs did. Of course, we used other things, we used the other things I mentioned. But fast forward now, 7 years later. Now here I am thinking, okay, that was kind of like a kind of a unique thing that happened to her. She was working on a mission thing that she was at, and they were working on this house, and she fell in some wood, and there was a nail, and she got cut, and that was the whole thing. And well, it's probably a freak thing that happened, right? So I didn't think too much about it. Well, fast forward, just about a month ago, she ended up having another infection in the leg.
Wow.
She didn't tell it to me about it, so a couple, 2-3 days. Well, it blew up. And so I said, okay, let's go after this. The antibiotics didn't work last time, so let's just go with the herbs. Well, we did. And about 4 days later, it was probably 80% better. Oh, her dentist said, you can't come back to work until you go to emergency and get a doctor's prescription and a doctor's excuse at emergency room. I won't accept it, anything else. So she said, okay, I'll do it. So we went there reluctantly, and they lanced. There was a couple spots that had pustules, and they lanced 3 spots. Ooh. And those 3 spots, but mind you, it was 80% better by this point with the herbs. They lanced them. We came back home the next day. It flared up, and those 3 spots became angry. They became very infected, those 3 spots. So I started treating it with herbs again. So a week later, it's probably 95% better, Demetri. And I said, okay, I'm going to church now. I could finally leave home. I was glued to the home for like a week. So I left. I came back home a couple hours later, and I looked at her leg, and it's flared up again. I said, Leslie, did you do anything? She goes, my sister had these oils, and she said it would, my skin was really dry. She said it would really help to moisturize them. So I put these oils on. It turns out, Demetri, and for our listening audience, it turns out that the person that made those oils had 7 dogs in her home, and they had parakeets, and they had canaries flying all over the place. The oil was contaminated, and it started a whole new area in the back of her leg. It wasn't there before.
Oh, wow.
I'm dealing with that for another week. And It was a real fiasco. It took a month, and it's finally totally healed. But I have these pictures.
Wow.
I have the pictures of it. It was absolutely horrendous.
Yeah, sanitation when you're making remedies is pretty important. I mean,
oh my
a lot of
gosh.
people think they can just pop them together in their kitchen. And yeah, technically you can, but you really have to clean like you're going into surgery, especially if someone else is going to put it on your body. I have a separate like facility where I just make this stuff for us. I don't make it in my kitchen.
Thank you. Thank you for that. Because for our listening audience, if you're going to make any herbal remedies at home, listen to what Demetria just said. You have to have a sanitary area. Certainly
free from pets, free from kids. You're going to have to use stuff like bleach or an autoclave, or, you know, you have to use sanitation and sterilize. You just have to. It's not safe to do it otherwise. You don't necessarily have to use bleach, but you know, you can use a sanitation thing on a dishwasher, whatever. But you really, you know, you have to act. I tell students, like, act like you're processing meat, right? You don't want any contamination if you're processing meat, right? It's scary when you think about it. So I'm like, I tell them, act like you're processing, you know, something that people eat. And, you know, it's easier to think that way instead of, oh, well, I'm just making an infused oil. Well, your infused oil is going to, you know, have problems if it doesn't go into a clean jar. If the oil's not clean, if the plants aren't clean, if the lid's not clean, and people are like, oh, it's so much to think about. Yeah, that's why we pay people to do this as jobs. So you don't have to do it unless you want to.
We don't want to discourage people from trying to dabble.
Absolutely not.
Remedies. But as you said, common sense says make the area clean like you're preparing food, and just be sensible and use common sense and make sure that surfaces are clean. There's no animals around or children around. Just be careful. So anyways, that's another thing that we need to take care of. Is if we're going to do that, use common sense. So let's talk about some of the other remedies that a parent might have. Let's say a child has a tummy ache. What are we going to do for that?
So actually, I have that section of that marked in my book.
Okay.
So I love for stomach aches doing like really simple stuff, like a simple clove tea or a tummy glycerite, which is using glycerin, peppermint, lemon balm, ginger. It's made like a tincture, and I don't have a problem with giving my kids alcohol-based tinctures. I mean, I'll be honest with you, 3 drops of tincture is going to have a lot less alcohol in it than that apple juice they pick up in the back of the minivan that was there from yesterday. In the sippy cup. I guarantee you that's got more booze in it than the 3 drops of tincture. And whenever I say that, people are like, oh, that's gross. And they're like, yeah, my kids have done that. You know, everyone's kid is like picked up that juice thing from the day before and just started swilling it down in the car. And you're like, stop. So yeah. But like things like peppermint, lemon balm, they're really, so first of all, kids
chamomile.
Like those. Chamomile's great. Chamomile sometimes can be a little earthy for some kids. And so that's why I usually like suggest things like the peppermint and the lemon balm, because it's just like, it's so easy for kids.
They love the peppermint oil. That's just a really nice.
No, this is the tea.
Well, yeah, but I use the peppermint oil.
But too. So I don't use essential oils often on children.
Yeah, I like to use the peppermint oils that are actually food grade oils. You know, they're really good. There's several companies that have them. I know in the doctor's world, in the clinician's world, there's companies that have them. I'm trying to think of the company that was out in Oregon or in Washington State. I can't think of it right now, but I used to buy them all the time. And that peppermint oil is it's delicious tasting, and it's calming to the nervous system. You can put it behind the ears of the child if they're crying. That works really well.
Yeah, I don't put essential oils on little children.
Oh, okay. That's okay.
Just as a clinical aromatherapist, it tends to be, they would need to be really highly diluted. in order for it to be safe for children. And so there's a lot of companies that talk about, oh, our oils are food grade, but there actually is no such thing as that as food grade. All oils are bought on a commodities market.
No, I'm sure I beg to differ with you. There's clinician, food grade peppermint oil that's available. It's not a essential oil like you buy
Okay.
from.
Oh, okay. All right. Yeah, I'm thinking of something different then, because
No,
a lot of
no.
people drink
This is
essential oils, and
this
I'm
is
like,
this
no,
is
stop.
it's made with glycerin. It's made with glycerin. Okay.
Oh, okay. Okay. So you're
And it's
talking about
got
like a glycerite.
yeah, yeah,
Cool.
but yeah, and so anyways, these are, and that's very mild, and that's why I use them for, like on the children to calm them down, the babies. It works really well. I learned that from Dr. Christopher a long time ago that, you could use those herbs for things like that. And you don't have to necessarily use the oils. I agree with you that the essential oils can be pretty strong. I mean, when you take an essential oil, those are really potent. They're really highly concentrated.
Yeah, and honestly, rarely are they needed. And so, I mean, even as an aromatherapist who trains aromatherapist, there's a big responsibility with showing people how to use those things safely. People will be like, "Oh, I just rubbed it all over my kid's foot," and I'm like, "Yeah, that's probably why they're freaking out, and can't sleep."
Mm-hmm.
Or, "Oh, my baby fell asleep." Yes, you completely overstimulated them, and that's their stress response shutting down. You didn't calm your baby. And it's sad because there's a lot of information out there that really preys on well-meaning parents who want to be more natural. And it actually, when they come to me or someone like me, and then they get an education, they really feel bad because somebody sold them something that then they feel like, oh my gosh, did I hurt my kid? And I'm like, look, it's once or twice, kids can bounce, like kids, but I mean, it's tough because there's so much information out there. We see it every time there's something going around in the world, oh, drink this, essential oil blend and you'll cure Ebola. And it's like, no, really, if that would cure Ebola, we wouldn't have Ebola. I mean, like, we just wouldn't have it. Enough people would say Ebola has been cured, and some would say we should do some research on this. So, but the reality is that I think all parents want to do something that helps their children and that's safe.
Yeah. So we're talking right now about herbal remedies for children who have tummy aches, and Demetria has given us some good tips on what to do if your child has a little tummy ache. You can do the things that she's recommending right here, and safely. These are safe remedies that you can use, and you can just make tea. Sometimes the tea will calm the tummy down.
Absolutely.
So that's a nice thing to do too. People don't have to get all these heavy duty things out, like you said, the essential oils. You don't have to do that. You just got to make a tea, something simple.
And if you introduce them to kids when they're really young, sorry, I didn't mean to interrupt you, because a lot of people say, "Well, my kids won't drink tea." If you introduce them really young, they actually don't care. Or as my kids would say to me, "This is gross," and I'd say, "Pound it," and they'd go, "Okay." You have to make it into a game or something like that.
Tea party. How about having a tea party? Remember the kids had tea parties with nothing in the cup?
Tea party, mix it with a little bit of juice, put it in a popsicle.
Make a real tea party. There's, they have the tea parties with the fake cups, and you say, "Oh, this is delicious." Well, make a real tea party.
Absolutely.
Make it fun. That's the key, and teach your kids from an early age how you can use food as medicine. Herbs are foods. You don't have to be afraid of them. People get so scared. Like, I remember my first wife. Her sister, when we were raising our children with herbs, she said, "Don't bring those stinky herbs around my kids." It's like she was so adamant. She was so adamant about it, like, don't bring. And she would run to the doctor and get all these drugs all the time. It was crazy, and yet she was like averse to using herbs, which are foods. And now I just think, I always go back to the Bible, which says the herbs will be used for the healing of the nations. So that's a pretty cool thing to hang your head on. The herbs will be used for the healing of the nations. And it's mentioned not only in the Old Testament, but in the New Testament too. So it's prophetic as well. So we should rely on using the herbs to help. And we don't have to run to drugs all the time. Use food as medicine. That's the first thing. Teach your children how to eat healthy, natural food. And then if they need some herbs, that can be an adjunct. You don't want to,
absolutely.
Eat junk food and then take herbs. You don't want to do that. That's distorted, right?
No, well, that's so American, right? I'm going to eat like 4 bags of chips and drink a smoothie and I'll be healthy. It's like, it doesn't work that way. But I mean, the reality is, kids need.
Or go to McDonald's, drink Coca-Cola, and then take some peppermint oil.
But I mean, we really have a disconnect in some ways with feeding children. It seems to be everyone else's problem. And it's really like a national security risk that our children aren't fed in school highly nutritious food. If you think about it, if you want a bunch of dummies, you start by not feeding them. Mm-hmm. You start by not feeding them, not giving them fresh air. People are getting rickets again. Children are getting rickets again, or being vitamin D deficient. I mean, that's a huge problem. And, making sure that kids eat good food while they're at school, and making sure that they're outside while they're at school, getting fresh air and sunshine, really fresh air no matter the weather. I remember when my husband's in the service, I worked at a child development center. And we would take 40 babies out every single day in northern New York, no matter the weather. They would spend some time outside. We'd have these big, huge strollers, or the kids would be in the playground every single day. There was almost not a day where the kids weren't outside. There was almost not a day that they weren't talking about good food for the kids and stuff like that. And that really stuck with me because it was before I had children.
Sure.
Because the kids who went outside were the healthy ones.
Sure. Well, now let's talk about parents, young parents who have babies that have diaper rashes. Let's talk about that for a minute. What kind of remedies used for diaper rashes?
Honestly, breast milk.
I love it.
But there's lots of things. You can put a little yogurt on the baby's butt. If it's a rash that's caused by urine, and there's breakthrough bleeding, and the skin integrity isn't there, go and get yourself an organic version of something like Crisco and make a vapor, or not a vapor, a wetness barrier, right? Give the skin some time to not have that ammonia from the urine on, or whatever is in the diaper that they're wearing, off of the skin for a while. And then you can use a diaper, diaper cream, butt balm, whatever. There's lots of products out there. You can make them. You could use just calendula oil, or St. John's wort oil, or plantain oil based salves. But, often with diaper rash, the best way to get rid of it is to just get rid of it and take out the diaper. Mm-hmm. Let the baby go to the bathroom and air dry. Let them spend some naked time on the blanket. Yes, they're probably going to pee on the blanket. But, just often it's just why do you have diaper rash? Because you're in a diaper too long. How do we get rid of diaper rash? Take off the But, that isn't always an option for people.
Yeah.
Also, look at what's in your kids' diapers.
What I love about you, Demetria, is you've already given, for 3 different conditions, you've said breast milk. I love it. You're an herbalist. Here you are an herbalist, and you're saying, go to breast milk. This woman is not about selling herbs or selling her herbal school. She's about teaching you about how to keep your family healthy. If you want to learn how to start making herbal remedies, and you want to help other people, then maybe you should consider looking at your school. Talk about your school here for a minute, okay?
So yeah, I'd love to. So the school was founded in 1998. Um, I was like the first herbal school online. I'm pretty sure no one's refuted that. I had my first herbal company online in 1996. So people were pretty annoyed with me early on. Like, we can't teach herbs online and you can't do this. And so whenever someone tells me I can't do something, I'm like, challenge accepted. So but I was like, I was running a school. I wanted a way to do it sustainably and to use all the resources I could in order to make it accessible for everyone. I wasn't interested in being just accessible to like the wealthy people who could go away for 2 weeks and study. That's not viable if you have children. And so my first audience were people who had children, people who had lives, who were busy. And so we developed the program based on that. And it's just grown over the years. I think we've trained like over 135,000 people.
That you have? How long is the program?
So there's a few programs. So we have the clinical herbalist program, which is 3,500 hours. No, yeah. Something like that. The program is 3,500 pages. So, and then there's
3,500 hours, you said?
Yeah. So there's, it takes about 2 years to complete.
Okay.
Some people with herbal knowledge can complete it faster, but the reality is it's like anything else. So I always say, if you're a good cook, you can be a good herbalist because you already know how to fit things together and how to make substitutions. So I'm super practical, if you can't tell. I'm like, how do I get from A to B with causing the least amount of damage to the world? And so if you're good at stuff like that, herbalism is almost an extension of that, because the first herbalists are cooks. They're, the people who work in the garden, the people who work in the field are foragers. Those are the people who were the first herbalists. And so if you're practical with that kind of aspects in your life, then you're probably already an herbalist. You just don't have the quote herbal education, but you already have you understand like some of the fundamentals of, how to preserve things, how to find things, how to properly pick things. So it's pretty cool. And then we have like a certified herbalist program and an introduction, and then a program that's just for children's health. And we also I run a doula training organization.
Now the secondary level of courses, obviously they're not going to be a 3,500 hour or 2 years. What if somebody wants to get interested in learning about herbs? What's the basic entry level for people so they understand that there's different levels here?
Introduction to herbalism.
And how long is that course?
It usually takes most people 3 or 4 months, and that's like with your life. So when I say the time, it's really based on what students normally take to complete. So, most of our students have lives and children and, jobs. So they have things they have to do. So, it can take a few months. Some people go through it faster. Some people take like a year. And we're really flexible with that kind of stuff because, one, you may enroll in the wintertime and we're saying, hey, go out and harvest something. And you're like, I can't because I live in Manitoba and I'm in 8 feet of snow. And so the reality is that we're really flexible and we want students to work with herbs that come from their environment. So I'm very much a believer of, if someone calls me in the middle of the night, I'm like, what's in your medicine chest? What's in your spice rack? What's in your yard? What's in your herb garden?
No, I want to make a mention here, which I think is really appropriate at this moment. One of the herbalists that I was raised with, and him as Herbal Ed from Herb Farm, going back to Herb Farm again. I remember him, one of his lectures that he was giving with Dr. Christopher, and he said this. He said, if you're sick and you don't have the specific herb that is going to be appropriate for that condition, he said, just grab any herb and just start taking the herbs, because all herbs have phytochemicals and compounds in them that have healing properties. So I thought that was a really interesting perspective. So don't feel like if you don't have echinacea around and you've got something going on, and you can't grab something in your kitchen cabinet, whether it's garlic or whether it's ginger, or whether it's cilantro or whatever,
oregano.
Yeah, whatever you've got, use it. Basil. I mean, don't make it complicated. I love Demetria's mindset. Keep it simple. This is a beautiful mindset. So, okay, so what's the name of your school?
It's Heart of Herbs Herbal School.
Okay, perfect. So people can go online and go Heart of Herbs Herbal School.
Heartofherbs.com.
Okay, heartofherbs.com.
Heart of Herbs Herbal School.
Folks, this woman is for real. She's got lots of knowledge. She's got a heart, and that's why she calls it the Heart of Herbs. She's got a heart to help people. This is a beautiful school. There's a lot of knowledge. You can get them different levels of entry. She's written books on herbs. By the way, for our listeners who are trying to get to help their infants, their children with herbs, what's the name of your book on children's healing with herbs? What's the name of that book?
It's called Herbal Healing for Children. I said I like to keep it simple.
You have a copy in front of you there to show?
Yeah, but it's been chewed up by my dog.
Oh, we won't blame that. We won't. Hold it up again. Come on, hold it up again. Now let's see it. That's okay.
Okay. This is from the puppy.
Yeah, that's okay. That's all right. I got some books like that I've written too. I've written 7 books, so I've got some books that my dog got a hold of too. So don't worry about it. But anyway, so that book right there, you can get online, right? Right, Demetria?
Yeah,
you can buy
absolutely. You can get it all major booksellers.
Okay, good. That's perfect.
Well, I'm sorry, what?
By all means, if you have children, get that book. You can really make sure that you're not going to have to have sleepless nights worrying about your children. There's simple remedies that nature has provided. The good Lord has given us these things. Take advantage of them. It's really wonderful. So, we're getting, we have got about a few more minutes here of time. Is there any?
Just to let you know, I'm not hearing you.
You're not hearing me right now. What happened? My goodness. Oh, wait a second. Quick comment. I don't know what's going on. You can't hear me right now?
I'm just hearing hiss.
You can't hear me. That's unusual. I'm not sure what's going on. Can you hear me now? You still can't hear me? My, oh my, oh my. I don't know. Have an idea what's going on. What in the world happened? Is it on your side? Your speaker working okay? Is your speaker working all right? Check your speaker. Not sure why. Can't hear me? I don't know what's going on. I don't know why. Not sure why. Oh, well, the show must go on somehow. Can you hear that? You can't hear that. Lord have mercy. Well, I don't know. Live viewer comments, it says over here. I don't know, folks. Well, not sure what happened here, and I'm hoping that my listening audience can still hear me. Demetria can't right now. So we're going to have to end the broadcast from this end. Hopefully, those of you who are tuned in.
Yeah, I'm still not hearing you.
Yeah. So I'm not sure what's going on. I've never had this happen, but always something, hide out, hide chat. I'm going to write in the chat here. Oh, I don't know what to say. I'm going to write something in the chat. Hear you. I can hear you. Look in the chat.
Well, should we say our goodbyes?
Yes, yes. Oh, yay.
I'm sorry, I can't hear anything you say. Thank you very much.
This has been
We've
a
had
blessing.
a lot of fun. I appreciate your time. And
Thank you.
Thank you. Bye-bye.
Adios. Adios. Okay, so I hope that my listening audience can hear me, but if you can't, I'm so sorry about that. So I'm going to end this right now as well. If you can't hear me, well, I apologize, but technicalities do happen. I was really blessed to have Demetria on the program. And if you've never listened to the other side of medicine before, come on back and we will continue to bring you experts in natural medicine, functional medicine, natural healing, so that you and your family can stay healthy and be able to and just enjoy a life of becoming independently healthy. That's what I want for you. Until next time, God bless you. Ciao for now.